almost 100 children here in Indonesia have died from acute kidney failure so far this year. And as of October the 18th, there have been 206 cases found, with 99 fatalities recorded so far.
Now, the Health Ministry, the Indonesian Pediatric Association, or IDAI, and a team of doctors at Cipto Mangunkusumo Hospital are working closely to investigate the disease. And to know more about this, we have joined by General Practitioner at MMC Hospital, Dr. Rizani, Putri, Iman. Good morning, Doc.
Good morning.
Morning, Doc.
How are you?
Thanks for joining us.
Thanks for coming. So, first of all, maybe you can explain to us what exactly is acute kidney failure.
Okay, so thank you for the invitations. So acute kidney failure is a clinical condition that is characterized by a sudden decline in kidney function. And this may occur over the course of several days or even less than that. So it is actually not very typical to be prevalent in among younger populations, especially in those with with a very good health. But like as of these several months, we've been observing like a sudden spike of these cases among children, especially those within the age of under 6-year-old, where they don't experience any previous illness or like chronic kidney disease or other previous precipitating factors that are usually present in acute kidney injury patients.
Okay, well, we do know over the last couple of days, we've been receiving updates. Obviously, the Health Ministry is investigating the cause of this. They're led to believe that paracetamol could possibly be causing this as well. But before we get into that, this has been happening already since the start of the year.
Yes.
So what are some of the more common causes of acute kidney, this condition, especially in children? Because it seems to me like something that would happen to your kidney would happen later on in life, not when you're such a young age.
Yes, so in general, there are 3 major causes that can contribute to the presence of acute kidney injury, where the first one is the lack of blood flow to the kidneys. That is usually caused by dehydration or excessive bleeding. And the second one is when there's a blockage in the urinary flow.
Okay.
That is often found in patients with kidney stones or other stones in the urinary tract system. But the last one is the direct damage to the kidney. This is what the experts believe to be emerging right now. And that can be caused by certain medical conditions like prior infections or multi-inflammatory syndrome in children with prior infections. But it can also be caused by other consumptions of certain medications,
Right.
Or any other substances, basically, that are considered to be toxic to the kidneys.
Because everything has to go through the kidney. The kidney
Yes,
is like
correct.
our filter for
Yes,
the
that
blood
is
in our
right,
body,
yeah.
right? Yeah.
Yeah.
So that's quite concerning because the first 2 are, again, things like a kidney stone. It takes time to build up
Yes,
a kidney stone. It's not
yes.
something that can just happen immediately.
yeah,
So it's
that
the
is right.
third, I guess, that's more concerning right now.
Yeah.
A lot of concern. Now, we also want to know about the spike that has been going on for the past 2 weeks. What have you know so far about this kidney failure in children?
So this current condition that we're facing right now, it's an atypical progressive acute kidney injury where the cause has not yet been concluded just yet.
Right.
It is suggested that the cause were caused by the syrup-based medications which
Right.
contain diethyl.
Paracetamol.
Yes. But not the paracetamol itself, but like the solvent for basically lots of syrup-based medications. And those ingredients are diethyl glycol and ethylene glycol. So these are supposedly the cause of the culprit of this current condition. But it's not yet conclusive just yet.
So is the reason possibly that it's happening in children and the reason why the Ministry of Health has asked us for now to avoid liquid-based syrups or medicines is because kids consume those a little bit more than adults? Like adults would take mostly pills, right?
Yeah.
Like we would take a headache medicine would be in a capsule or pill form, whereas for kids, if my kid gets a fever, I'll end up giving him or her a little bit of a syrup like fever control medicine. and that's quite common, isn't it?
Yes, so yeah, syrup-based medication, they're more common to be consumed among children. Yeah.
Okay, so what's the solution then? Because I mean, we've got little ones at home, and that's the first thing we do. As soon as you get a fever, like we got to control the fever first for a couple of days, and then first thing we turn to is a liquid-based medicine. Kids can't really, especially little ones, they can't swallow pills. So what would be an alternative for parents right now, since they have to avoid liquid-based medicines?
So yeah, so the first of all, parents should be aware of the non-pharmacological approach of for their children's conditions, like fever. We can do like a warm. We can apply a warm compress to children with fever.
Is it warm? It's not cold.
It's actually warm because
that's a myth, right? Everyone's like trying to cool you down.
That's also a common myth. Like if it's warm, it can dilate your blood vessels, which can cause like it's better blood distribution for the children.
I see.
It can like produce heat loss from the body.
So we've been doing it wrong. I know I've been doing it wrong. I've been doing cold compress. I've been making it worse. Oh my goodness. Okay, go on.
Yeah. Well, other than that, you can also maintain your children's fluid intake. That will also control the heat loss of the children with fever.
Okay.
But as for now, we can't consume like the liquid or syrup-based medications, right? So what we can do is like we can consult to the doctor for any kind of medical conditions. Then the doctor will presumably they will give you like drugs in the form of granules or like tablets.
I know those ones. You have to mix it yourself. It tastes horrible, but but
make sure you do a consultation with the pediatrics.
And let's just hope that our children will take it.
Because I panic as soon as I get a fever. I'm like, uh-oh, fever, and like right away I go to that liquid-based medicine.
So just consult with your pediatrician. Okay. Now we also want to know, doctor, about the chances of recovering from acute kidney failure. What are the chances?
So it basically depends on the severity of the injury itself. So there are multiple levels of injury to the kidney, which can vary from mild to the severe ones. And if it's just a mild case, then usually it is treatable. The kidney function can reverse to its normal function.
Right.
So no need to panic.
Yeah, as long as we know what's the underlying cause here. And also early detection and prompt treatment is very important in this condition. So when you notice any sign of symptoms of acute kidney injury in your children, then you should promptly consult with your pediatrics. Doctors.
I remember every time that my kid has a fever, the pediatrician always asks if he peed well, because that's the indication of his kidney is working well, right?
Yes, that is right.
So you have to make sure.
Yeah, we hear this a lot, like early detection, not just for this, like for most illnesses. We also reported that several of the children that died in the hospital in Bali, it was because they had already reached the later stages. They had to, I guess the treatment would have been, the last resort treatment would be hemodialysis, is that correct?
Yes, that is correct.
So how long is that window that we have if it's acute kidney disease that does not get diagnosed and treated in time? What's that window like? Because I hear it's pretty fast, like the turnaround.
It is actually pretty fast. Then again, we have to bear in mind that what we are facing right now is an atypical progressive acute kidney injury. So it is atypical in the mean of term that we still don't know what's the underlying cause. If we know the underlying cause, then we can treat the cause itself, and it will
directly,
cause it will cause improvement to the kidneys. And the second one is that this disease seems very progressive, so it can progress very rapidly. That's why we have to the window is pretty small, and we have to be aware of our children's urinary habit.
How many days, doctor?
Well, it depends. It depends on the kidney function at the time your children is.
Oh, how healthy the kidney is to begin with.
Yes.
Okay, then let's talk symptoms, because those are the early signs, right? Now, a lot of these symptoms are overlapping. I've read them all, and it just seems like, well, it could be anything. Yeah. And some of it may not, unless it's severe, may not be alarming enough for us to immediately say, hey, let's take the kids to the hospital immediately. So what are some of the more telltale signs that we should be looking out for? Maybe a combination of certain symptoms. Like with COVID, it's the one where you can't smell or taste anything. You're like, okay, it's most likely COVID, right? So are there any telltale signs that can point us towards the right direction?
So, okay, so once again, the main product of our kidneys is the urine output, right?
Right.
So, urine output is like, it's the most important symptoms that can be experienced by the children.
Okay.
So, you have to be concerned if your children like show lack of urination, decreased urine output, or even absence of urine output within 6 hours window. So that's when you have, that's when you have to consult to your pediatricians or doctors. Or
so basically kids should be peeing at least every 6
Yes.
hours. The color, because we do know that if it's lighter in color, then they're likely quite hydrated.
Yeah.
But if it's more of a yellow or perhaps even the darker the color is, the less hydrated they are. Does that matter?
That is right. Yeah. So when your children show like a darker color of urine, that shows signs of dehydration, and especially if there is if you notice like any redness or like any blood in your child urine, that's where you have to consult to the pediatrician.
Right, because that's like very bad damage.
Yes.
All right, so we'll keep an eye on that. Now, our last question would be, Doctor, can we prevent this from happening, and what should actually we do as parents to protect our children?
Yeah, so it is, luckily it is preventable. And what we can do right now is eliminating the exposure to the potential causes. So as we know right now, the potential cause might be like the ingredients in syrup-based medications. So that's what we do right now. The Ministry of Health has advised us against the use of any kind of liquid or syrup-based medication.
Okay.
So. And the second one is to consult with your pediatricians or doctors or like any healthcare providers. Basically, it's about your children's medical condition. So it can be evaluated. It can be further evaluated if there is any abnormalities in your kidney functions.
Okay.
And also the most important one is like you have like to perform good hygiene and also eliminating the source of infections, and that is very important to prevent the infection at the very first place.
What about nutrition? Is there any sort of nutritional tips that we can, like some things are better for our kidneys, like what's good for our kidneys and bad for our kidneys? For kids, anyway.
Yeah,
for adults, I know
kids.
what it is. Bad for our kidneys.
Well, it's very obvious
Less
for
coffee.
adults. Yeah. Well, for children, it's pretty much the same. Basically, fluid intake is what very important because, if as previously mentioned, the most common cause of acute kidney injury, one of the most common causes is dehydration. So, fluid intake is important, especially those that contain electrolytes, like fruit juices or mineral water. Basically, it's very good for the kidney function. And other than that, maybe like diet that has low sodium intake, because it can cause water retention in your kidney.
Oh, that's right.
Sodium.
Yeah.
All right. Okay, well, good to know.
Thank you,
yeah, it is quite alarming, this news lately, especially for parents out there, I'm sure. But good to know that there's things that we can do to try to avoid or prevent that. Thanks, Doc, for dropping by on this Friday morning. And we hope that some of you were able to find some of these tips insightful and perhaps apply it to your daily lives. In the meantime,